We all know the standard depiction of pregnancy. It's presented as 9 magical months of joyful nesting, glowing skin, and effortless anticipation. But for the mother, the physical reality rarely matches the brochure. It usually involves severe morning sickness, crushing physical exhaustion, and the quiet anxiety of navigating a complex medical schedule. If you are the partner in this equation, you want to be supportive. The problem is, general advice like be nice or help out lacks any practical framework to actually solve the daily challenges she is facing. The margins for error here are narrow. Missed windows for specific medications, poorly timed ultrasound scans, or deficient nutrition have a direct biological impact on both fetal development and maternal recovery. To genuinely support your partner, you need an actionable, rigid operating manual designed to optimize health outcomes. You need a protocol. Effective support relies entirely on trading your own personal convenience for active daily project management. Here's exactly what that entails. The first intervention requires a complete restructuring of your household diet. This means your personal dietary routines and preferences take a backseat for the duration of the pregnancy. You need to manage the macronutrient inputs. Prioritize proteins like paneer, lentils, and well-cooked eggs. Keep calcium levels high with milk, and enforce a strict hydration baseline of 8 to 10 glasses of water every single day. You also need to enforce strict avoidances. Strip the pantry of junk food and eliminate highly spicy foods, raw meat, and caffeine from the daily routine to ensure maternal and fetal safety. Implementing this diet gets complicated quickly by the most common physical barrier, morning sickness. Combating nausea requires your direct input early in the day. Your job is to wake up before she does and prepare dry carbohydrates, like plain toast or biscuits, so they are available the exact moment she wakes up. From there, shift the household eating schedule away from 3 large meals to a routine of small, frequent meals. You can manage lingering nausea with ginger tea or lemon water, turning to medical antiemetics only if your doctor advises it. By taking total ownership of meal prep and these early morning routines, you stabilize her blood sugar and eliminate a massive daily stressor from her plate. Next, we move to your most critical daily vigilance task, medication optimization and schedule enforcement. During the first 3 months, folic acid is mandatory. Consistent daily doses are required to secure the baby's early brain and spinal cord development. Once you hit the second trimester, around month 4, the schedule changes. Your doctor will introduce iron and calcium supplements. This abstract diagram illustrates a biological conflict you have to manage. If swallowed at the same time, iron and calcium clash and block each other's absorption. To solve this, enforce a 4 to 5 hour buffer zone between the iron and calcium doses. You should also set daily alarms for her multivitamins, which serve as the baseline safety net to cover any remaining nutrient gaps. Regulating this 4-hour gap guarantees the mother actually absorbs the skeletal and blood-building benefits, actively preventing severe developmental failures. Let's look at the mechanics of maternal rest. The strict biological requirement is 8 hours of uninterrupted nighttime sleep, plus an additional 1 to 2 hours of rest during the day. In the later months, you need to monitor positional requirements. Sleeping on the left side becomes heavily encouraged. This schematic comparing sleep positions shows exactly why. On the left side, pressure is lifted off the major veins, opening up a wide, unobstructed pathway for blood and nutrients to flow directly to the growing baby. Protecting this required sleep window requires a trade-off from you. It means absorbing the bulk of the evening household chores and adjusting your own sleep habits so she can rest. By handling those evening duties and aggressively protecting her rest time, you directly lower her cortisol levels and physically enhance the baby's blood supply. The final evaluation pillar relies on navigating the medical bureaucracy. You must proactively block calendar time for specific ultrasound windows. This timeline tracks crucial ultrasound milestones. Book the early scan at 7 to 8 weeks to detect the heartbeat. Next is the NT scan between 11 and 13 weeks. The most critical is the Anomaly Scan at 18 to 20 weeks, checking the developing organs. Following that, you'll track late-stage growth scans and attend routine monthly checkups for weight and blood pressure monitoring. Treating these scan windows as immovable project deadlines is your primary defense for early anomaly detection and ongoing health monitoring. The most profound emotional support you can provide over these 9 months is tactical, daily reliability that lowers your partner's cognitive load. Look at this scorecard. If you are extremely short on time, this is your bare minimum. Own the iron and calcium spacing alarms and secure the calendar date for the Anomaly Scan at 18 weeks. If you have the bandwidth to fully optimize the process, take complete control of the early morning nausea protocol, the dietary overhaul, and the total reduction of household stress. Absorbing all of this daily logistical stress directly lowers maternal cortisol and creates the optimal biological environment for fetal growth. The lifestyle trade-offs required to execute this are demanding, but this exact protocol only lasts for 9 months. Your vigilance in managing these daily details ensures the biological needs of both mother and child are met, building the foundation for a healthy start.